Welcome to the Omni Dental and Med Spa podcast. Today we're embarking on an in-depth exploration of something many of you might be wondering about, underbites. Specifically, we'll dive into the fascinating question, can Invisalign truly fix an underbite? This deep dive draws from a collection of valuable insights and resources provided by Omni Dental and Med Spa, a leading practice right here in Arlington Heights, Illinois. They offer, well, a full spectrum of dental and aesthetic services. Our mission today is to cut through the noise, helping you understand what an underbite is, the impact it can have on your life, and, when those discreet Invisalign aligners might be your perfect solution, or perhaps when other treatments might be a more suitable path. So get ready to gain some real clarity on this pretty common dental concern. Okay, let's really break down what we're talking about here. What exactly is an underbite? It's more than just a slight unevenness, isn't it?
That's a great question to start with. Essentially, an underbite occurs when your lower teeth extend out in front of your upper teeth when your jaw is closed. Think of it like a reverse overlap, if that makes sense. It could be genetic, something you inherit, or it might develop because of improper jaw growth.
Ah, okay. Genetic or developmental.
Exactly. The good news is it's definitely correctable, but the approach often involves specialized orthodontic procedures, treatments designed specifically to align teeth and jaws. What's really interesting, though, is that underbites aren't all the same. We actually classify them by severity. So a Class 1 underbite is mild. These are often caused by slightly misaligned teeth, and yeah, they could typically be corrected with traditional braces or sometimes even Invisalign, especially if caught early.
Okay, mild sounds manageable. What about the next level?
Then there's Class 2. That's a moderate underbite. Here, the jaw itself might be slightly out of alignment. These cases often need a combo of orthodontic work, and in some instances might involve, well, surgical considerations.
Surgery. Okay, that sounds more involved.
It can be. And finally, Class 3 is a severe underbite. This often points to a significant jaw discrepancy, and usually it can't be fixed with braces alone. It frequently requires surgical intervention to get that proper alignment.
Yeah.
Understanding this classification is really the first step,
Definitely. It's incredible how much variation there is. And beyond just how it looks, which I imagine is a big concern for people,
Oh, absolutely.
what kinds of deeper problems can an underbite actually cause for someone?
Right. It's far more than cosmetic. The impact can really ripple through daily life, affecting basic functions and even confidence. For example, speech problems are very common. When the front teeth aren't lining up right, it can make it tricky to pronounce certain sounds clearly.
Like which sounds?
We often hear about trouble with S or F sounds. That can become, a source of self-consciousness, especially in social settings or at work.
I can see that.
And then you have the physical symptoms, that constant misalignment. It puts a lot of strain on the jaw. So we frequently see patients with chronic jaw pain. Sometimes it radiates into headaches or even neck aches.
Wow, neck aches too.
Yeah. Some might feel pain directly in their teeth or lips. And a really common complaint is a clicking or popping sound in the jaw when opening or closing their mouth. All these issues really stem from the jaw being forced into an unnatural strained position. Leads to muscle fatigue, joint stress. It shows how a dental issue isn't just about teeth.
That's a powerful point, yeah. Connecting oral health and overall well-being. So let's get to the question that's probably on everyone's mind. Can Invisalign, those clear, almost invisible aligners, actually fix an underbite? We hear about it for straightening teeth all the time, but this seems like a bigger deal.
It's the million-dollar question, isn't it? And the answer is yes, but there's a crucial caveat. It really depends on the root cause and, like we discussed, the severity.
Okay, so what's the condition? When can it work?
If your underbite is primarily because your teeth are crooked, or maybe tooth decay has caused things to shift incorrectly, then yes, Invisalign can be incredibly effective.
How does that work exactly?
Well, the way it works is pretty ingenious, actually. You get a series of custom-made clear aligners, like trays. Each aligner is designed to gently, but very precisely, shift your upper and lower teeth towards their correct spots. And what's fascinating is by strategically moving the teeth, Invisalign can also create the space and sort of the leverage needed to guide your jaw itself into better alignment.
Really? It can move the jaw too?
Subtly, yes, by correcting the bite. So it's not just about straight teeth. It's about fixing the entire bite. And in many cases, it addresses the jaw misalignment if it's directly related to where the teeth are positioned.
That's where it gets really interesting for people considering treatment, the idea that a discrete aligner can do all that. What are some of the standout advantages of choosing Invisalign for this, especially with those capabilities?
The advantages are pretty compelling, particularly for adults or maybe teens who are conscious about their appearance. The most obvious one, of course, is the look. Aligners are virtually invisible. That makes them a fantastic choice if you're, self-conscious about traditional metal braces.
Right, the visibility factor is huge.
Totally. It means you can go through treatment without feeling like everyone's noticing your orthodontics. And beyond appearance, there's significant lifestyle flexibility because the aligners are removable.
Oh, yeah.
You don't have the same food restrictions you get with braces. You can eat what you want. Just pop the aligners out, enjoy your meal, brush your teeth, and put them back in. Plus, it makes keeping your teeth clean much easier, brushing and flossing normally. Reduces the risk of plaque or cavities, sometimes seen with fixed braces. It's a good blend of effectiveness and convenience.
It certainly sounds like a revolutionary solution for many. But as we kind of touched on earlier with the class system, are there situations where an underbite is just too complex, maybe too severe for Invisalign alone?
Absolutely. And this is exactly why that initial thorough assessment by a professional is so critical. If your underbite is severe, like that class 3 we mentioned, or if the main problem isn't tooth position but a significant structural issue with the jawbone itself,
Okay.
then Invisalign on its own probably won't be enough. In those scenarios, traditional braces, often combined with jaw surgery, might be the necessary path to get the best functional and aesthetic results.
So surgery might still be needed sometime.
It might. However, it's worth noting that orthodontic tech is always advancing. There are new possibilities. For instance, there's a procedure sometimes called a dental slide. It's not major jaw surgery in the usual sense.
What is it that?
It involves a very precise, subtle repositioning of a small segment of the jawbone. When you do that alongside Invisalign treatment, it can provide the structural foundation needed for the aligners to then finish the job, moving the teeth and correcting the bite. For certain cases, it can be a less invasive alternative to big surgeries, allowing for a more discreet treatment overall. But again, it all comes back to understanding the precise cause of your underbite.
That's step one.
Got it. So finding the right expert for that diagnosis and tailored plan is key. Now, for our listeners in Arlington Heights and nearby areas thinking about this, Omni Dental and Med Spa is a resource. What should they know about their specific approach?
Yeah, for anyone considering these options, Omni Dental and Med Spa are located at 305E. Rand Road in Arlington Heights offers really comprehensive evaluations and personalized care. What sets them apart, I think, is their holistic approach. They blend advanced dentistry with aesthetic treatments, recognizing that a confident smile often involves more than just the teeth, right?
Makes sense. Tell us about the team. Well, the practice is led by Dr. Bilas Poles, BDS. He brings over a decade of extensive experience in general, cosmetic, and restorative dentistry. He's highly skilled in advanced treatments, including Invisalign, even for complex cases. But what patients often mention is his patient-centered care. He really takes the time to educate each person, making sure they understand their condition and all the options. He believes in creating a comfortable, sort of stress-free environment.
That sounds crucial, especially for potentially complex treatments.
Exactly. That commitment to personalized care, plus using state-of-the-art technology for precise treatment, that's really their philosophy.
So it's more than just fixing teeth, it's about the whole patient experience.
Precisely. Their dental services cover everything, from essential preventive stuff like deep cleanings to general dentistry, cosmetic work like whitening or smile makeovers, and advanced things like dental implants, even full-arch solutions. And, living up to the med spa part, they also offer a wide array of aesthetic services. Botox, fillers, advanced skin treatments like microneedling, laser hair removal, even permanent makeup. It's like a one-stop place for oral health and overall well-being.
Wow, quite comprehensive. And for those listening who might not be right in Arlington Heights, how accessible is the practice?
Oh, they're quite accessible to the wider area. Omni Dental and Med Spa serves not just Arlington Heights, but also nearby communities like Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, Des Plaines, and Elk Grove Village, too.
So a pretty broad reach.
Yeah, quite broad. And a really great thing is they offer a free consultation. This is perfect if you're curious about addressing an underbite. It's a chance to meet Dr. Poles, get that professional assessment, and just discuss if Invisalign or something else is the best fit for you personally. You can easily schedule that by calling them at 847-483-8833.
What a truly illuminating journey into Underbites and the amazing capabilities of Invisalign. We've definitely seen that while Invisalign is a powerful and discreet tool, especially for underbites caused by tooth misalignment, The key really lies in understanding the severity and the specific origin of your underbite.
Indeed. And if we connect this to the bigger picture, it just profoundly underscores how important a thorough professional assessment is for any dental concern, really. Knowledge is great, but it's most valuable when it's understood and applied correctly. Taking that first step, consulting an expert, it can truly transform not just your smile, but your overall comfort, function, and confidence.
So what does this all mean for you, our listener? Maybe it's a reminder that those subtle discomforts or cosmetic things you've been living with, they can often have deeper implications for your health, how you communicate, your confidence. But crucially, your journey to a healthier, more comfortable and confident smile might be far closer and more achievable than you ever imagined. Thank you so much for joining us on this in-depth look. We hope you feel more informed and empowered about understanding underbites and the remarkable possibilities that advanced, patient-centered dental care like that offered at Omni Dental and MedSpa can provide. For more info or to schedule that free consultation, you can call 847-483-8833. Until next time, keep digging deeper into what makes you well.